Welcome to Adult and Pediatric Dermatology Worcester's grand opening. We are celebrating the opening of our new and beautiful office conveniently located at 288 Grove Street in the heart of Worcester. Tonight we will be following AP Derm's strict COVID protocols, but for clarity purposes I'll remove my mask. Rest assured all event attendees will be wearing a face mask unless safely socially distanced. Tonight you'll hear from Rich Nee, CEO of AP Derm, and MOHS surgeon Dr. David Geist. We'll take you on a tour of the facility, meet our providers, and we'll be raffling off an Elta MD gift basket and a Via dinner gift certificate, both valued at $150. Viewers will learn about the cosmetic procedure microneedling, as well as the latest treatments for hyperhidrosis. Also, we'll be learning about skin cancer treatments from Dr. David Geist. You can enter in to either win the Elta MD gift basket or Via dinner gift certificate by commenting your full name in the comment section. Adult and Pediatric Dermatology and the Worcester Chamber of Commerce are excited to start tonight's celebration with a ribbon cutting. And now I'd like to introduce Alex Gordiola from the Worcester Regional Chamber of Commerce to say a few words welcoming adult and pediatric dermatology. Alex?
Thank you, and good afternoon. My name is Alex Guardiola. I'm Vice President of Government Affairs and Public Policy for the Worcester Regional Chamber of Commerce, and very excited to be here on this grand opening and ribbon cutting for AP Derm. Again, this is the 31st location. Happy to have you in Worcester. Worcester obviously is a growing city. We're now by far the second biggest city in New England, fourth in the Northeast behind New York City, Boston, Rochester, and now Worcester. So thank you again. I'm so happy this is going to be a success for you and excited to have you in Worcester. Thank you. Now I'd like to also introduce our senator here in the Worcester area, Senator Michael Moore.
Thanks, Alex, and welcome, Rich, and everyone part of AP Derm. It's nice to have you here in Worcester. As said, Worcester is one of the fastest growing cities in the area. We just broke 200,000 people, and it's nice to have you be part of it. When I first got elected many years ago now, it seems like yesterday, one of the first committees that I was the chair of was the Committee on Small Business and Community Development. Even though you are a medical practice, which we desperately need here, your services, and to increase access for the people of Worcester and predominantly our kids, small businesses, you are a small business, and that makes up 86% of our economy. Or not just Worcester, but in general, 86% of the economy. It's not these big, huge corporations. So you are part of the backbone of the local economies, and we're glad to have you here. And we hope that this will be a very successful operation, and so successful that you'll maybe open up your 32nd branch. But it's great to have you here, and I guess it's my pleasure to introduce the CEO, Rich.
Thank you, Senator. Appreciate the warm welcome to Worcester. We're super excited to be here, participate in the growth of Worcester and the growth of AP Derm as we provide our services to the greater Worcester area. I thought I'd give you a little bit of background on AP Derm. Not everyone knows about us, but we've been in business since 1992, started by our founder, Dr. Samuel Goose, who's still our managing partner. And he started the business with a simple philosophy of making sure patients had a great experience and great care. So with that idea, he built and created and attracted the best talent he could find, and the business grew over time to where we are now, as mentioned, our 31st location. We're an integrated dermatologic services organization, so we provide all of your skincare needs, from your general dermatology needs, Mohs surgery, cosmetic, and we have an in-house pathology lab, so we can take care of your pathology needs very quickly. Even though we've grown quite a bit in the 29 years we've been in business, we still focus on the simple mantra of making sure the patient gets great care and has a great experience. So everybody that's joined the team and everybody that's here is focused on that to make sure that those patients have a great experience. One of the things we pride ourselves on is access. So the reason we're opening this office is we want to make sure patients can get in and get seen. It's frustrating when you have a skin condition and you have to wait to get in and be seen. That happens in many areas because there's a shortage of dermatologists. So we want to make sure patients can get in, get their issues taken care of quickly, and so that's why we're here, and we're super excited to be here. We have 4 providers that will be working out of this office. We have Drs. Geist, Dr. Williams, Dr. Sanderson, and Shelley Whedon, PA, which we're super excited to have all, and they're all extremely high quality local physicians that will help make sure you have great access and great care. With that,
Yeah, hold on, I actually forgot something. Sorry, Senator Moore again. I also have the pleasure of presenting a citation from the State Senate in recognition of the opening today. Be it known that the Massachusetts Senate hereby extends its congratulations to AP Derm in recognition of the ribbon-cutting ceremony celebrating the grand opening of your Worcester West office. Your newest, I'm sorry. I don't have my glasses on. Your newest Worcester West office. It's signed by myself and Senator Chandler, who shares the city with me. So congratulations.
awesome, thank you, that's really nice.
Thank you.
Great to see. Well, with that as a start, we can't help but be successful here and help patients get great care. Now, I would like to introduce one of our partners and one of the surgeons that will be working out of this office, Dr. Geist. Dr. Geist?
Thank you, Rich, for the introduction. I'm thrilled to be standing here in our new AP Derm Worcester office. Worcester's my hometown, and I'm really excited to increase our access for dermatology here in Worcester. We'll be able to treat adults, kids. I do skin cancer surgery. We'll have skin cancer surgery services as well as regular surgical services here in our office. I'm also really excited to bring AP Derm's style of patient-centered dermatology to Worcester. We focus on patients having great expert care and a great patient experience. You know, AP Derm is a physician-led practice, and that infuses everything we do, trying to provide the best care for our patients. So, again, excited to be here in Worcester and looking forward to meeting many of you.
Thank you everyone for the warm welcome to the Worcester community. Now we will take a tour of the facility and meet 2 of our AP Derm Worcester clinicians, Shelley Whedon, Physician Assistant, and Dr. David Geist. To enter to win the VIA gift certificate, please enter your full name in the comments section, and our winner will be announced after the microneedling treatment. And now, please join me for a tour of our Worcester office. In this location, we are offering medical, cosmetic, and Mohs surgery appointments. For cosmetic, we are offering services such as Botox, microneedling, and laser treatments. We have a Mohs surgeon on site and also are offering phototherapy treatments for phototherapy needs. At our front desk, we do have for purchase medical grade products such as Elta MD sunscreen and Skin Medica. Our front desk receptionist will be happy to help you purchase anything that you need. We have a Mohs suite for all of our surgical patients and their own dedicated waiting room while they await their treatment. Thank you for taking a tour of our Worcester location with me.
Congratulations on the new adult and pediatric dermatology Worcester location. Can you tell us a little bit about yourself?
Yes, my name is Shelley Whedon. I am a physician assistant practicing here at the new Worcester office. I have over 20 years of experience as a physician assistant, 8 of which have been in dermatology here in the Worcester area. Prior to that, I worked in emergency medicine. I originally started my healthcare career as a registered nurse and went to Worcester City Hospital School of Nursing. I'm just thrilled to be here.
Can you tell us a little bit about the Worcester office?
Yes, it's at 288 Grove Street in Worcester and is a brand new, beautiful facility. We are treating patients of all ages. I primarily will be doing skin cancer screenings, and we are able to treat the skin cancers here on site with Dr. Geist, who is a MOHS surgeon. We also have cosmetic treatments, laser treatments, and we also treat acne, rosacea, as well as any other skin ailment.
Can you tell us what dermatological issues you provide?
I provide skin screenings for patients of all ages. I also treat acne, rosacea, and perform cosmetic treatments such as Botox. I also treat hyperhidrosis with Botox, and that is when you have excessive sweating.
And now watch a microneedling procedure with physician assistant Shelley Whedon.
Hi Jackie, nice to see you again today.
Hi Shelley, how are you?
I'm great, thank you. So you're here today for your microneedling procedure?
Yes. I'm a little nervous. Can you tell me a little bit about it, a little more?
Absolutely. So as we talked about before, this is a microneedling, and we will be rubbing the needles across your face. And what this does is it promotes collagen regrowth and also resurfaces the skin.
Is there any side effects?
You may be a little red and perhaps slightly bruised for a few days following the procedure, but there really is very little downtime.
Oh, and is it a series of treatments? Because my daughter's wedding is in 2 months.
Yes, well, you should see some improvement after the first procedure, but it is best done if you have 4 to 5 procedures. They're spaced about 2 to 4 weeks apart.
And is there any side effects, or what should my regime be after I get the procedure?
After you get the procedure, you should wash your face with a gentle face lotion. And the most important thing is to protect your skin from the sun and wear SPF every single day.
And is there any contraindications, like if I have, I don't know, scarring or anything like that?
Well, if you are prone to scarring, such as keloids, we probably wouldn't want to do this procedure on you. But you may feel slight discomfort during the procedure, but we will apply a numbing cream prior to starting.
Okay, great. I think I'm ready to go.
Great. I think you'll be very happy.
Awesome. Thank you.
The winner of the Via Dinner gift certificate is in the banner below. To enter to win the Elta MD gift basket, please enter your full name in the comment section below. The winner will be announced after the Ask Our Doctor section. Now learn about treating hyperhidrosis or excessive sweating from Shelley Whedon, our physician assistant, and learn about skin cancer treatments from Dr. Geist, our MOHS surgeon.
Hi everyone, I'm Shelley Whedon and here to talk today to you about hyperhidrosis. I am a physician assistant and will be practicing at the new Worcester location, which I'm very excited about. I have been treating hyperhidrosis for many years. That is a condition of excessive sweating and it affects many, many people. It most commonly is located on the scalp, face, underarms, palms of the hands, and soles of the feet. This can affect patients very physically and psychologically. It can affect their performance at work if they have dripping or sweating of the hands and excessive sweating of the axilla. It can also affect them psychologically, causing embarrassment, if they have excessive dripping or have to change their clothes frequently throughout the day. I have seen many patients that can only wear black clothing because they have so much sweating of the underarms. The causes of this we still don't really know, but we do think there is a genetic component to it, as many family members also suffer from this. And it tends to occur in adolescence, but it can occur at any time. There's primary hyperhidrosis, which is in adolescence, which again is genetic. And there's also secondary hyperhidrosis, which may be due to a medical condition such as diabetes or a thyroid disorder. It also can be related to a medication you may be taking. So that's very important to discuss with your primary care physician or your dermatologist to see if this could be caused by a medication. The good news is there is treatment. Now, when we see a patient with hyperhidrosis, we first would like to start with topical treatments, which can be effective. Antiperspirants and deodorants can be very helpful, as well as topical dry sol or aluminum sulfate, which can help clog the pore and help clog the sweat gland. This can be very irritating to the skin and not be very effective for many patients. The other options are oral medications. We try glycopyrrolate or oxybutynin, and that can shut down the sweat glands, but it also will shut down all the sweat glands, which is not ideal when you're trying to focally stop the sweating in the palms of the hands or the axilla. This can be dangerous in an athlete or someone who works in a very high temperature location where they do need to sweat to cool down. But we do monitor this very closely, and the medications can be very effective. In our practice, we will treat with Botox injections. This is very effective and can give a patient a lot of relief and actually be life-changing. We will inject the Botox to the areas that are causing them distress, such as the underarms or the palms of the hands or the soles of the feet. I have even injected scalps when someone has excessive sweating of the scalp with dripping, and it has been extremely effective. It is minimally invasive, and we would inject small amounts of the medication into the area. It takes about 10 minutes and can last about 3 to 4 months. Some patients, it lasts up to a year. It's very patient dependent. and very different for everybody. The side effects are very minimal, and usually insurances will cover this, which is the great news. And it's, like I said, it's life-changing for many. And we do offer this at AP Dermatology. Other treatment options which can also be effective are ionitophoresis, where you would get a device and place your hands. This is great for palmar hyperhidrosis, where you place your hand into a shallow bin of water, and an electric current can block the sweat gland of the palms. This is a device that we would need to get coverage from your insurance, and sometimes that is not as effective as what I've seen with the Botox treatments. There's also a handheld device called MiraDry, which can be effective for the axilla. But again, Botox is also extremely effective to this area. So I would be thrilled to take care of you if you do suffer from this, and please call AP Dermatology and schedule your appointment and consultation, and we would be happy to take care of you. Thank you so much. And if there are any questions, I'd be happy to answer. I do see a question coming up. Can this be used on children or teenagers? That is a great question. So the FDA approves Botox for 18 and under. However, I have written letters I have seen young children say 14, 16 years old who have severe palmar hyperhidrosis. Some can't hold a baseball bat or have trouble holding a pencil at school, and we will write letters, and some insurances will then approve it. And it is very safe. There are no side effects. It is a very safe medication to give. So yes, some insurances will approve it, but they do like to say it's over 18 and older. But I have gotten it approved for under 18. Yes, that's a great question. Here's a question. Should folks see their pediatrician or primary care physician before seeking treatment via a dermatologist? Yes, it's always important to first talk to your primary care physician. Like I said, it could be a medical condition such as diabetes or a thyroid disorder or a medication, and that's always great to discuss with your primary care physician first. They can also prescribe Drysol, which is that topical medication, which can sometimes be very effective. Let me also add, there's a new topical pad called Qbrexza pads. This also could be helpful if someone did not want to go forward with the injections. That's also, I found in pediatric cases, this has been very effective as well. So again, yes, it would be great to first start with your pediatrician and your primary care physician, and then come to see us if you're still having the effects of this. So I think that was the last question. How often do you have to get injections? Generally, it's every 4 to 6 months. I find that it does last, and it's very effective for 4 to 6 months. And I have found that as most of the patients that do come in are adolescents, teenagers, young 20s, but after that, it does tend to improve after that. So, but 2-3 times a year is generally how many times I've been taking care of patients with this. And yes, here's another question. Does insurance cover? Yes, they do. Most insurances have no problem covering this because they do understand the effects this does have and how effective the treatment is. And again, just come in for a consultation and we will take care of that part of that prior authorization with your insurance company. Okay, I guess that's it. Thank you, everybody. And up next is Dr. David Geist to talk about surgery for skin cancer. Thank you.
Hi, everybody. I'm Dr. David Geist. I'm really excited about opening our new office in Worcester. I'm going to be there performing skin cancer surgery. I'm a dermatologist. I have special training as a skin cancer surgeon. This means that after completing my dermatology residency, I did an additional year of what's called fellowship training, specializing just in skin cancer removal and management and the reconstruction after the removal. MOHS surgery is one of the primary skin cancer removal techniques, and the fellowship is focused on that. I've been doing that for over 10 years. MOHS surgery is a technique that we use for skin cancers that are located in cosmetically and functionally sensitive areas of the body, such as the face, head, neck, hands, and feet. We also use it for tumors that are large or aggressive, so that we can trace out all of the parts or fingers of the cancers as need be. You can read a lot more about MOHS surgery on our website and also on the American College of MOHS Surgery website, which has some great resources. Tonight, I want to spend some time talking about my approach to skin cancer patients, what it's like to come in and meet with me and my team and have a skin cancer surgery. I find that a lot of patients coming in for the first or even the second or the third time can be pretty nervous, and I have a really wonderful, kind, expert staff, and we try to put you at ease coming in to be with us. You're going to be with us for a couple of hours typically, though the surgery is not going on all the time. You're sitting and waiting. One of the things I like to do first is just sit with you and look at the pathology report so we can talk about the skin cancer and answer questions that you have about it. Most of the MOHS surgery skin cancers are basal cell skin cancers or squamous cell skin cancers. These are chronic sun damage skin cancers from sun damage built up over all the years. A common question I get is, do these skin cancers turn into melanoma? And the answer to that is no. And then we want to talk about the treatment options. Typically, your primary dermatologist has sent you to me because they think MOHS surgery is a good option, but sometimes there are other options to consider, and we'll talk those through. They range from some creams or scraping, or sometimes even radiation treatment. And I want to make sure that we're going to do the right treatment for the right patient for the right cancer. Assuming that we do want to proceed with MOHS surgery, we'll talk that through in some detail. I should also mention that some of my more mature patients, it's a really great conversation to have about whether it makes sense to do surgery, and there are certainly risks to not doing it, but I do want to make sure that what we're going to do is in the best interests of each patient and their values, the family's values. So we'll have that conversation when needed. We'll talk a little more in detail about your cancer, how aggressive it is, what to expect from the surgery. I mean, the average with MOHS surgery is that we take a stage and then you sit and wait while we process it. And it's about 45 minutes to wait. The average is to go twice. Sometimes it might just be once. And sometimes it's 4 or 5, or last week we had one that went 6 times because there was just more cancer under there than met the eye. But that's the great thing about MOHS surgery, is being able to trace out the cancer and make sure we can remove it all and get the best cure rate, which is 98 to 99%. In the beginning and then later, once the cancer is removed, we'll spend time talking about how we're going to fix the area or get the area to heal, the reconstruction of the area. Depending on how complicated the tumor is and the location on the body, there are lots of different approaches that I can offer that we can discuss to see what's, again, going to be the best for you as the patient for this area, and what's going to fit your life, your values the best. Sometimes it's a simple closure. Sometimes it might involve a skin graft where we borrow some skin. Sometimes it might involve a skin flap, which means making some additional incisions locally and moving skin into place. And sometimes things will heal in on their own, and that might be the best option for someone. We'll talk about how there's always going to be a scar. You know, the goal is to trade the cancer for a good-looking scar. Scars tend to do better as the months go by, so it's important to have that expectation up front that there's going to be a process, and we'll go through it together if need be, and there are things we can do to tweak scars as they move forward in time to try and get the best result. I always want to be there with you to get the best result from your scar. Another thing that we'll talk about early, middle, and late in the visit is what the activity restrictions are after surgery. This can be a lot of delicate surgery in areas we want to have a really great outcome. About a third of how the surgery turns out cosmetically probably has to do with my handiwork. About a third of it is definitely up to the patient. You need to restrict your activity. You need to be prepared to restrict your activity for days, sometimes a week, sometimes more, from exercise, from chores, sometimes from work. Sometimes it's really sitting around at home to get the best result for the long run. And we'll go over that with you and make sure we're on the same page about that, and that what we're going to do is going to fit into your life in a way that's going to get you a good outcome. And then my staff's really great about getting you bandaged and going over all the details about how to take care of the area going forward. We're always there to help by phone, or if you need to come in and have us look at something or change a bandage. We just want you to have a great outcome. So that's a lot of what to expect when you come in to have Mohs surgery with us. We're a nice bunch. It can be a lot to go through for people, and we understand that. And we're going to be with you every step of the way. So again, I'm really excited to be coming to work in Worcester, which is my hometown, and I look forward to meeting folks and helping you out. And now I'll be happy to answer any questions that come up. Yeah, I mean, that's a great question. You know, there's no set age. It's really important to work with your primary doctor and see what kind of, you know, specialist care is going to be valuable for you. If you're someone who's had a lot of sun damage, you know, beginning in your youth, then it's not too early, especially if you're fair skinned, to get in your teens or 20s for a skin check. Likewise, if you have a lot of moles, you may want to have them evaluated at least once early on. Could be in childhood, could be teenage years, to just see if any of them have concerning features to be monitored. If there's a family history in particular of melanoma, which can have a genetic predisposition, that's a recommendation that everyone who's a first-degree relative to that person gets a skin check as a baseline at some point. It's really, yeah, the question is, should I get a skin cancer screening, you know, every 6 months or every year? It's really individualized for each patient, and not everybody needs a skin cancer screening. Patients who've had a skin cancer should absolutely get, at an absolute minimum, a yearly skin cancer screening. And then we typically recommend, when you've had a recent skin cancer, that this be at least every 6 months. And if you've had a recent melanoma, the recommendation may be every 3 months. But it'll be something individualized, you know, with your dermatologist based on your situation. Yeah, this is a great question, and this goes to one of my favorite topics, which is telling you all the things that you can't do. So you often go home from Mohs surgery, almost all the time, with a big pressure bandage, and you got to go home and you got to just sit there and not do much. And that means you're not cooking dinner, you're not cleaning, you're not doing chores, you're not running errands, you're not taking the kids to soccer. You really want to let your body rest and let the stitches rest and the wound rest so that everything's going to heal up smoothly. Because if you're real active, you can bleed, you can rip a stitch, or you can just kind of traumatize the skin between the stitches, and the skin can die. And then the scar doesn't heal well. It takes a lot longer. It doesn't look as good. So, you know, recommend planning days to at least a week, and sometimes we'll talk about even longer, that you have to be on very light activity. And then once we get out past that point, you can start to get back to your normal activities. But I certainly don't recommend any big adventures or travel coming up right after your Mohs surgery, it's almost always better to schedule it after you have activities coming up. Mohs surgery has so the question is Mohs surgery a permanent solution in the sense of a cure? And for an individual cancer, Mohs surgery typically has a cure rate of 98 to 99%. So that's one of the higher cure rates probably in medicine. There's a small risk of something growing back, and certain cancers, more aggressive cancers or recurrent cancers, might have a slightly higher recurrence rate than that. But for that individual cancer, we're going to consider the Mohs surgery to be a really good chance that that one's never going to come back. Unfortunately, for folks who've had a sun-damaged skin cancer like basal cell or squamous cell skin cancer, we would estimate that in the next 5 years, there'd be about a 40% chance that you're going to have another different local sun-damaged skin cancer somewhere due to your overall sun damage burden built up over all the years. So my team and I get a lot of repeat customers who we love to see. I don't know that they always love coming back in with us. I mean, I think they like us okay, but. Great. Well, it's been a pleasure talking with you all tonight. And similarly, while I hope I don't have to see many of you, I'll certainly look forward to helping you out when need be. And I think we're going to announce the winner of the ELTA-MD gift basket next. Take care.
Thank you, Shelley and Dr. Geist, for that informative talk. We are now going to announce the winner of the ELTA-MD gift bag. Thank you everyone for attending Adult and Pediatric Dermatology's Worcester's grand opening. We are so pleased to be part of this community. To schedule an appointment, please give us a call at 508-719-9878 or go to www.apderm.com to book online.